Canada's asylum health costs surged to $900 million. MPs demand answers. Welcome back to Canada Chronicles. Today we're breaking down one of the most talked about issues in Canada's immigration system right now. The surge in asylum-related healthcare costs that has pushed federal spending close to $900 million. Members of Parliament from all parties are demanding answers, and the pressure has revealed deeper issues inside Canada's refugee determination system that most people never see. If you've been wondering why these costs are rising, what is driving the sharp increase in claimants needing federally funded healthcare, and how delays affect taxpayers, stay with us. In this video, we go beyond the headlines. We look at how billing practices, processing delays, and coordination across governments all contribute to these escalating expenses. And near the end, we uncover the hidden weak point driving costs even higher, a crucial factor experts believe Canada must confront immediately. Make sure you watch until the end. If you haven't subscribed yet, hit that button and turn on notifications so you never miss updates that could shape your future in Canada. Let's get started. A growing bill Canadians didn't see coming. Canada's Interim Federal Health Program has reached a level few anticipated. Originally designed as a small humanitarian medical safety net, it has become one of the most financially pressured components of the entire immigration system. Annual costs approaching $900 million represent a year-over-year increase of more than 30%, raising urgent questions about oversight and long-term sustainability. What worries many lawmakers is not the obligation to provide essential care to vulnerable people seeking protection, but whether the program can meet current demand without losing public confidence. During a recent committee hearing, Immigration Minister Lina Diab faced pointed questions about what is driving these rising costs. Conservative MP Matt Strauss, who is also a physician and former medical officer of health, pressed the minister with concerns rooted in both fiscal responsibility and clinical practice. He highlighted the surge in program enrollment, now exceeding 440,000 individuals compared to roughly 350,000 the year before. The minister confirmed the rise and noted that asylum claims had declined by 33% from January to September of 2025, but clarified that spending will not fall immediately because many claimants remain in the system awaiting decisions. Why 440,000 people are now covered? The leap in the number of people relying on the program stems from forces both inside and outside Canada. Around the world, conflict in the Middle East and East Africa has displaced millions. Climate-driven migration continues to increase. Even with Canada's geographic distance from major conflict zones, the country continues to receive asylum seekers at airports and land borders. Inside Canada, processing delays at the Immigration and Refugee Board have lengthened the time people remain awaiting decisions. Longer wait periods mean longer eligibility for federal health coverage. Even when new claims decline, older files sustain demand. Strauss called this a structural contradiction. Canada is legally required to provide essential health care. Yet slow adjudication extends the amount of time claimants rely on support. Minister Diab clarified that the Immigration and Refugee Board, an independent tribunal, controls refugee determinations and not her department. She noted that recent investments have improved processing speed, but acknowledged the system is still under strain. Inside the $900 million question. As MPs continued their questions, Strauss shifted the focus from claimant volumes to billing practices. He pointed to cases where anesthesiologists billed up to 5 times the provincial rate for surgeries performed under the Interim Federal Health Program. Although the Canadian Medical Association recommends billing at about 2.5 times the provincial amount to account for federal administrative costs, some practitioners exceed that threshold. This wide variation underscores the lack of a unified national billing standard for the program. Because healthcare delivery is provincial while funding for asylum claimants is federal, fee structures are inconsistent across the country. The minister stated that new budget measures include stronger audits and updated guidance, but officials stress that meaningful reform is complicated by differing provincial systems. Without unified digital infrastructure, federal administrators must verify claims manually, which slows oversight and increases exposure to overbilling. The strain on Canada's refugee determination system. Another major contributor to rising costs is the pressure on Canada's refugee system itself. Even with recent improvements, many claimants wait extended periods before receiving decisions. While their files remain active, Canada must continue providing healthcare. This creates a direct financial incentive to reduce backlogs because lower wait times lead to lower healthcare costs. Minister Diab pointed to Bill C-12 as one of the government's tools for improving processing speed. This legislation aims to streamline triaging, strengthen digital submissions, and support more efficient decision-making. Analysts agree that the legislation could improve timelines, but many note that legislative changes must be paired with additional staff, better digital systems, and long-term investment to keep pace with global migration pressures. Strauss asked whether the government had analyzed how delays directly influence costs. Department officials responded that while delays add pressure, Canada is legally obligated under domestic and international law to provide medical care until a claim is resolved. Failing to do so could create humanitarian harm and public health risks, especially if untreated conditions spread within communities. The debate over billing and accountability. Strauss's background as a physician brought attention to the lack of rigorous oversight in billing. Without standardized fee schedules, the program can be billed amounts that significantly exceed provincial norms. Several economists argue that the federal reimbursement model needs to be modernized to prevent unnecessary costs. Some experts say integrating the program's billing into provincial digital systems could reduce errors and add consistency. Federal officials explained that previous attempts to integrate systems were slowed by different provincial platforms and verification procedures. Achieving harmonization would require major intergovernmental coordination and financial investment. Nonetheless, many observers believe modernization is unavoidable if Canada wants to control long-term costs, the humanitarian and public health reality. Amid the budget debate, advocacy groups stress that asylum seekers often arrive with medical needs resulting from trauma, lack of access to care, or dangerous journeys. These needs can include chronic conditions, communicable diseases, and untreated injuries. When illnesses go untreated, they can spread more quickly in communities and increase pressure on emergency rooms. Public health professionals emphasize that early treatment benefits both claimants and the broader population. Meeting those needs is considered part of Canada's humanitarian responsibility, but there is growing agreement that compassion and accountability must operate together. The future of IFHP spending. The federal government expects the growth of program spending to slow as asylum numbers decline, but that projection depends on global stability. Conflict, economic shocks, or climate-driven displacement could quickly increase demand again. Many analysts believe the upcoming review by the Office of the Auditor General of Canada will pressure the government to strengthen oversight and modernize program management. The long-term outcome may depend on improved processing speed, unified billing technology, and stronger coordination among federal and provincial governments. Thanks for staying with us this far. We appreciate your time and hope you're finding this information valuable. The hidden weak point driving costs even higher. One area receiving increasing attention is the outdated system used to validate medical claims. Each claim submitted by a healthcare provider must be reviewed manually. This process was designed decades ago and is struggling to handle the volume and variety of today's claims. Audits in 2025 showed that many claims required secondary review simply because formats differed between regions or providers. These inconsistencies slow down the system, increase administrative costs, and create opportunities for errors or unintended overpayment. Experts believe a modern digital platform could solve much of the problem. A unified system would automatically compare claims to provincial fee schedules, detect unusual charges, and instantly approve standard submissions. Implementing such a system would require investment and cooperation across governments, but observers argue it is the strongest long-term solution for stabilizing costs without reducing care for vulnerable people who depend on Canada's protection. As debate continues, Canada faces a pivotal test. Can the country modernize its systems, protect asylum seekers, and maintain public trust at the same time? As Canada works to manage rising asylum healthcare costs, it's clear that the challenge stretches beyond the numbers. The pressure on federal programs, the ongoing strain on the refugee determination system, and the gaps in billing oversight all point to the urgency of modernizing how Canada handles asylum-related healthcare. What happens next depends on whether the government can strengthen processing, improve accountability, and maintain the balance between compassion and fiscal responsibility. If you found this breakdown helpful, remember to like, subscribe, and turn on notifications so you never miss an update on Canada's immigration system. Thanks for watching and staying informed. See you in the next video.